love getting up in the morning and going into work. My job is phenomenal, and I love the people that I work with. It's wonderful to go in and be with such great colleagues and such a vast group of people. At the end of the day, it's really nice to go home and know that not only did I perform well as a dentist, but that I also did a service for my country, because I'm able to do things that you wouldn't be doing every day in a normal population. Navy Dentistry is just exceptional. All right, Dr. Alfano, I'm ready for you to come take a look.
Okay.
I went ahead and removed the healing abutment. Currently, I am in a general practice residency at Portsmouth Naval Hospital in Virginia. We have specialists in every field at the department. I not only get to do regular general dentistry things that I expected to do, but I get to be challenged with cases that normally would be referred to specialists.
Right here in the index as it goes into the mouth.
Okay, great. Right now, I'm working on a few implant cases, which is a great opportunity for me, because in school, you don't have enough time to follow that many cases through. But in the intimate environment at the hospital, I'm able to work closely with all the specialists and do a few of those every month.
In my advanced clinical program, I work with the endodontist and also the periodontist in their surgical specialties.
We suspect that there's a crack on the distal root of number 31.
Yes, sir. They work with me one-on-one so that I would at one point be able to do these procedures on my own.
I think that'll be the best option, and after consulting with perio and pros, that should be a treatment option that would be best from a surgical standpoint.
There is so much knowledge that if I have a question or a complication, I can go to them very easily and they can assist me or just point me in the right direction.
Mike, what I'm interested in, do you think that right joint looks like it's got some arthritic? The Navy offers a great group practice. You've got specialists in all fields.
At the same time.
Yeah, we want to be careful not to overtax the lateral pterygoid muscle, and I think you're absolutely right. We all started out thinking about solo private practice. That was the model, but it's tough being by yourself. The buck stops on your shoulders, and you have to have all the answers.
I do agree. It is an arthritic joint with some degenerative changes in the bone structure.
Okay, well what I thought I would do then is the wonderful thing about a group practice like the Navy is that you've got specialists all around you. You can ask anybody, anything, at the drop of a hat. I can interrupt a procedure and go ask a specialist about something.
This is kind of a unique opportunity because I am only 2 years out of my training program, and the variety of cases is really interesting. Most people, or most of my colleagues at least, from the civilian sector are in private practice, and the things that I get to do are really quite interesting, and they're somewhat in awe of, when they find out the type of cases that I get to, perform at the hospital.
Okay, let's check your comfortable mouth opening. I'd like for you to open as wide as you can. The third thing that I found especially pleasing about the Navy is the time that I get to spend with my patients. I can spend as much time as I need to make a proper diagnosis, and that's really important in my specialty of chronic pain management. I need to see if we can move it a little bit more. Okay, all right. Now, and that's something that I never had in private practice. I was always under the gun to see that next patient, because time is production, and production is making money, and that's kind of what the yardstick you use in private practice, where that's not the yardstick in the Navy. It's really the quality of time you spend with the patients, and I find that very rewarding.
I graduated from Tufts University in Boston. I received a full 4-year health profession scholarship from the Navy. Go ahead and put this on. It may be a little bit tight. This is just so that we can get... So far, I've already gone through anesthesia, where our main thing is to learn how to start IVs, how to protect airways, how to do intubations.
Great, okay, this is only gonna hurt for a second. Okay, now go ahead and disconnect.
It's a great opportunity also just to work with our attending oral surgeon and deliver all the medications and drugs.
One of the roles I play at the Naval Hospital is to teach residents, both oral surgery residents and general practice residents, and that has been a true joy. At the hospital, there are 4 oral surgery full-time attendings for 8 oral surgery residents and 5 general practice residents as well. But the other thing is there's basically every specialty known to dentistry at the facility as well. So if there's an issue that requires an endodontist or a periodontist, somebody is right around the corner.
I actually just closed on my property, And I think I may have been the only person in my dental class to graduate having more money in my bank than I owed to the bank.
My name is Lieutenant Heather Naw. Currently I am attached to the Marine base, so I get to go out and do field exercises with the Marines.
Corporal, what brings you to see me today?
Chipped my tooth today, ma'am.
How'd you chip your
When
tooth?
we're in the field with the Marines, you're there to provide dental support for any dental emergencies. Say a Marine is running any trips and they break off a tooth or they get an abscess tooth, they'll come to the dental tent and we'll treat them.
Just gonna take a look. Oh yeah, you chipped your front tooth.
It is definitely a very exciting angle on dentistry. You're doing stuff that you've read about. Your job or your role is very important, and it's something that's a little more than what I expected.
I am a lieutenant commander. My name is Gary Andrew Schulte. I am the dental officer on board a ship. On the ship, it's sort of like a big family because I see these guys every day.
Officer Williams has been on a home fluoride program.
I walk down the passageway and running into Seaman Timmy, somebody who I just worked on a couple of days ago, did some extensive work for him. And I talk to him and say, how's it going? And they tell me, everything's working out good, Doc.
Mr. Oliver, how's that x-ray? Good, I'm gonna go next door.
I know that I'm very well prepared. The Navy has trained me well, and I'm ready for pretty much anything that is ever gonna be thrown at me.
All right, so how are you doing today? My name's Dr. Schulte. We're gonna be
Being able to take care of everybody and having them trust you and hey, Doc, I know you're the specialist. Tell me what I need to do and I'll do it. There's a great amount of reward with that.
I would say compared to my colleagues in the real world, I do have a considerable amount of free time outside of the job.
I'm an outdoors person. That's one of the reasons I joined the Navy, is because I love being outdoors and I love being by the water.
And probably the biggest thing that I've been able to do is to be part of a band. That was something that I always sort of wanted to do in high school and in college, and I was a drummer for various bands growing up, and everybody always thought that I would kind of grow out of it. But needless to say, even going on to an aircraft carrier and being in the Navy, I still, have been able to be in a band. And actually found some great musicians. I mean, I was very surprised at the level of talent and the experience musically of these people who might be a master of arms or might run a nuclear reactor or whatever job they may have. I was very impressed with some of the talent.
You have 30 days of vacation a year, plus you have holidays. When you're with the Navy, you're usually stationed right around water, so it gives you opportunities to go kayaking, which I enjoy. So it's plenty of time to travel, to do whatever it is that you want to do. There's time out there.
So, did you see my toric reduction case today?
Yeah, I did. I did the extractions and the osseous recontouring.
A lot of people ask us, how can you work in the same clinic? But working in the same clinic is great because we have the same schedule. We go to work at the same time. We come home at the same time.
It's been a pleasure, actually. It's like she said, a lot of people say, how can you spend all day with your spouse and then go home at night and have to spend more time with her? But I've enjoyed it, and having lunches together, it's something that a lot of people don't get to enjoy, and we do.
While being in the Navy, I've visited several countries. I've been to Spain, France, Italy,
Jebel Ali, Australia, Tasmania,
Bahrain.
I was in Israel, was in Monaco. We actually got to have Thanksgiving dinner at the America's Club of the Riviera on Thanksgiving Day. That was quite an experience.
We have a lot of great people who are out there protecting our country, and it's nice to know that I'm providing them with the service and taking care of them and taking care of their needs and making sure that everything is going well for them.
I'm very proud to serve my country. It's one of the most fulfilling things that I've done, is I get to give back a little bit to the country that has let me go to school, that's let me borrow money to pay for school. Because without the government funding, I wouldn't have been able to go to dental school. I wouldn't have been able to afford it.
It was one of the most rewarding things to be in the Navy the first time. Something I talked about a lot when I was in private practice. And when I rejoined the Navy, it fulfilled a part of me that I didn't realize was missing, to really give something back to my country. And I benefit a lot from where I am, there's no question about that. But I feel like I'm doing my part to support our country and our armed forces.